Welcome to Human Factors for Interior Design, Part 3, looking at healthcare interior design. Here are the objectives. Evidence-based design is a big part of healthcare design, as are proxemics. We need to provide both spaces for privacy as well as interaction, and we want to provide a safe and secure environment. Wayfinding is very important in a large hospital. We want to understand good ergonomics for caregivers. Healthcare design encompasses a variety of facilities. These include medical offices, dental facilities, nursing homes, physical therapy centers. All of these will need proxemics to be understood. Waiting areas, where we're in there with many people, should have both a sociofugal and sociopedal settings. We like to combine areas for interaction and separation. In evidence-based design, we use evidence to conduct or locate research, use research from past projects, and apply findings to the next design projects. Healthcare facilities have been transformed into care facilities that are centered around the patient. The Institute for Patient-Centered Care has come up with these 10 principles. And I have added some design ideas you might consider that can reflect these 10 principles. When we talk about empowering a patient, we're giving that patient some control over their environment. If they can easily reach the lighting to turn certain lights on and off from their bed, if they can control the sound that they hear and how much privacy they have, both visual and auditory. When we talk about supporting healing, we can provide quiet spaces and areas that are appropriately sized. And when we want to support the staff goals, we definitely want to have efficient layouts, good lighting, and materials that help caregivers give good care. Generally speaking, we're going to have our public, our private, and semi-private areas. Wayfinding can include even artwork or murals, but it might include graphics such as this Discovery 3, because this floor is named for a certain theme, and this is the 3rd floor. This helps people remember where they've been and help them form a cognitive map. Of course, we also have graphics that are clear about where we are in the building. Maybe has a handout, perhaps even includes a map, or a kiosk might be nearby as we look to electronic items to help us perhaps create a directory as we see on the top. But interior designers also have an initiative to use the environment to help people understand the environment and remember it better, which is one of the keys to wayfinding. And then as we look down the hall, we see the orange, then the green, and then this yellow, so that we can see from a distance where we need to go. Toilet rooms are everywhere in healthcare environments, whether in a clinic setting or an inpatient setting. There's no restroom that is actually exempt from the ADA, except in a home. So you'll put in a 60-inch turning radius. At the lavatory itself, you'll put a 30 by 48, which is our standard wheelchair dimension, and then we use 56 by 60 inches at the toilet. Here's some variations on the theme, and depending on whether the door is swinging in or swinging out, will determine the size of the bathroom. Here's a little closer look at medical office buildings. These are your doctor's offices, and we can see we'll have the receptionist check-in, and we're going to provide that counter at 2 heights. We might have some relaxing feature like a water feature. We may have a quiet section, and we may have an active children's section. In our private area, we have our exam rooms, our staff areas, which is our lab, our sanitation, our soil room, and some storage, our offices, and our break room. Here's a 3D look at the reception area. In our exam rooms, we're going to have some way that we can incorporate technology while we're talking to the patient. We're looking at a very standard exam room that's been around for 30, 40 years. There's a counter that we have a hand washing sink and all of our supplies in there. Then the family sits in the corner in the back, and then the exam table is the focus of the room, and it's at the side wall. Oftentimes a patient's coming in there doesn't really need to actually lay down on a bed such as this to get their vital signs. We're also lacking the ability to use any kind of technology in this room. Steelcase, in its line called Nurture, has a lot of great products for healthcare. And they found that eye-to-eye conversations are very difficult in these outdated space configurations because the doctor may be standing up while the patient is sitting down, or the family members may be sitting down and the patient is up on the exam table. And access to information is hard to share because there's no room for the computer in that previous illustration, and there's no conference area or anything like that. The family member's sitting off in the corner. They can't really participate. So Steelcase researchers came up with a thing called the Diamond, and it allows greater involvement for the provider, patient, and family, as well as shared access to information. In some exam rooms, the traditional exam table could be replaced with a lower exam chair, especially if there's no medical task to be done, but rather a consultation. And this ensures that the physician and the family members are at the same level. And here's a glimpse of the future exam room where technology sort of takes over and becomes a focus of the room, and it helps in shared decision making. And we notice the Nurture recliner on the right has the exam light directly over the patient, and this recliner can actually lay down and the arms can come down to the sides. We can have even less space in an exam room, greater efficiency though. Here's an exam room in the children's facility, and we can see the staff is able to come in and wash their hands and use the computer at the lower section, and as they do, they're able to face the patient and the mother or father sitting on the bench with the child. They're on the same level, and if needed, the child can get up on the exam table. This is an area called triage room, and before one goes into an exam room, they may come in here and be weighed and measured, and this helps what is called the throughput to the exam room, and not take up valuable exam rooms, but rather be able to process some information ahead of time in this room. Hospitals play a large part in the community, become a center of focus. Our friends and our family are in the hospital for critical situations. We need the hospital to be very supportive of us. And it offers a variety of spaces, so we need to be prepared to design these variety of spaces, including restaurants, food service, equipment areas, retail, and healing gardens. In the past, we did not have semi-private rooms, and it was okay to have 3 or 4 people or more in a room. And the nursing staff really worked very hard, and there was no privacy for the patients. Single patient rooms have zones. The first zone being the staff zone. As they come in the door, they're not crossing over to the family zone, and they're just interacting with the patient. They have all of their hand washing equipment and good lighting for them to be able to perform medical tasks. The family zone is near the window and out of everybody's way, and of course the patient is in the center. A lot of discussion goes on for patient rooms about inboard and outboard restrooms, and what we mean by that is whether the restroom is towards the hallway or is it located towards the window. If there are individual nurse observation stations required, then that nurse will have access directly to look into that room. There's another type of room where the restrooms are placed back to back, and this is a mirrored layout. In this situation, the restroom is behind the cubicle curtain, and the patient is able to get up from the bed and use the handrail to get to the bathroom there. The family zone is towards the window. The wall on the right, where all the medical gases, the oxygen, and the suction are, that's called the head wall. In the Children's Hospital Project, the staff is able to come into the room, wash their hands. They're able to do some charting on the side of the patient. The family zone is on the side where you're standing. Rethinking patient rooms. Perhaps there are 2 different doors. One where the visitor comes in from the front, and another where the clinician comes in, and they're able to get into their clinical zone, and the visitor is able to come into a family sitting zone, which helps in times when a patient is terminal and a lot of family members are there. It gives them an extra area. And then here's the patient zone and easy access to the restroom. This is an unusual room. It's a labor and delivery room that allows the spouse to stay in the room after the birth of the child, as well as the child to stay in the room. And all the medical equipment is placed behind the doors on the right. There's even a hot tub in the room. The medical gases are concealed on the side walls of the bed. Of course, this is not an acute or critical room. This is a time of joy, but we still need to control pathogen or bacterial growth. We need cleanable surfaces. We need to have a nice design feature to the room. This gives us positive distractions. Imagine that there might also be music playing or aromatherapy. And design features that support the activities, but that might offer a new level of care. Let's look at facilities for our aging populations. We generally talk about continuous care retirement communities, but as facilities that go from independent living all the way up to assisted living. And we've looked at these small residential models before, and in this chapter we call it the human habitat model. And we can see the exterior of one of these small homes and one of the seating areas or the fireplace areas. And here's a floor plan from the book that shows perhaps this fireplace area is in the center with the dining area and an open kitchen with all of the resident rooms on the exterior with some other staff or support areas. Here's some examples where we can see this open kitchen concept in the service island, a nice big dining area so that it feels more like family. Healthcare design is one of the more complex areas of specialty for interior designers. It does require some very specific knowledge, but it can also be very rewarding because of the positive effects that design might have on the healing process. And all of the human factor requirements are in play at their very highest level, even the design for our senses. And let us not forget the spiritual aspect of design, which also can lead to the spiritual aspects of healing. Many facilities will have a non-denominational chapel of some kind because people do reach out to their faith when they're faced with crises. So I hope you will consider all of this as you design for healthcare in the future. Thank you.